more person joining by phone. How's it going? Good, sorry. It got so quiet. No, keep talking. It's fine. It's fine. We're not formal just because we're recording this. Those colors look weird up there, don't they? Funky. Blue. All right. Well, welcome everyone. I'm so glad you could join us. Please make sure you grab some food, and we'll go ahead and get started so we don't lose our valuable time here. So let's do introductions. I know many of you know each other, but for those of you who may not, let's do that, and we'll make sure to include the folks on the phone. I think we've got several today. So I'm Mindy Tueller, and I manage the medical health portal, and I facilitate this meeting. Kim Morton,
Maria Castro, coordinator at South Spring Clinic.
Kate Colbath, outcomes analyst at the Intermountain Hemophilia and Thrombosis Center.
Keisha Listuma, I'm with Comprehensive Care Clinic.
Christy Hendricks, health advocate, Briner Pediatrics.
Tiffany Meyer, nurse care manager, Briner Pediatrics.
Kay Haynes with the medical health portal. And Jenna Dower from Wasatch Pediatrics St. Mark's and care coordinator.
I'm Mimi Steele. I'm from Wasatch Pediatrics South Point, and I'm a care coordinator.
Athena from University of Pediatrics care coordinator.
Liz Wall, parent partner, Summit Pediatrics. Jesse Frisbee, Summit Pediatrics care coordinator.
I'm Becca Barker, care coordinator at University Pediatrics.
Dawn Bentley, the care manager at Mountain View Pediatrics.
And all the case outreach for Children's Hospital. Awesome. Okay, and can we get you guys on the phone to go ahead and mention who you are? Maybe we'll start with Alexa. Oh, she's muted. There we go.
I'm Alexa Jarrett, and I'm the care coordinator for Willow Creek Pediatrics on our Draper location.
Thanks, Alexa. Debbie, do you want to introduce yourself?
I'm Debbie Moore. I'm one of the pediatric nurse care managers with Select Health Insurance and Select Health Community Care.
Wonderful, thank you. Jade, how about you? Jade, we're not hearing you if you're able to talk. Maybe check your mute. I don't think Jade's muted, so maybe there's something else going on. So Jade Porter, and unfortunately, as she says, microphone is, Jade, is the microphone not working? There we go. Okay, no worries. Just tell us who you're with in the chat. She's with University Visa Health Plan. Great. Nice to have you with us. Sorry about that. Feel free to use the chat during the meeting. I'll watch it, okay? And then if you have comments or questions, do it that way. And Julie?
I'm Julie Olson. I'm with the Children's Healthcare Improvement Collaboration with the Chipper Grant. So just sitting in. Thanks.
Well, thanks, you guys. I'm glad you could join. I think we might have one or two more who may join via phone and go to meeting. But in the meantime, let's go ahead and get started. So the start of every meeting is our brainstorming time. And so I am hopeful that you guys have some issues, some cases that you're struggling with, and we'll see if we can't do a little working together to figure that out. So does anyone have any barriers that are running up against right now? Any problems in connecting families to resources? Any big issues? Any small issues?
This isn't a specific case, but does anybody know of any good prescription assistance options? That's one we get asked on a lot.
I know we referred to someone to primary children's pharmacy. She handles all of it. She would be a great person to have.
Okay. Oh.
Frankum is her last name, F-R-A-N-K-U-M. I will give you her first name. But
that's a really good idea.
No, but I
I don't know, I always just send it to her and then she handles it. It's magic.
There's a website called Needy Meds, and that might be a place too.
Yeah, that's one of the things on the list.
And then there's another, I think another website is called Good RX or Good Prescription. And people actually sign up and they get a card. And with that card, they get discounts at pharmacies.
I think I have seen that one. But I wasn't sure how reputable it was.
So the residents at South Main usually, they use that one quite often.
Is that a local one?
I don't think it's local, but the card can be used in local pharmacies. And not all of them accept the card, but
It also price compares for all the pharmacies in your area.
Right.
It's handy.
Oh, that's nice. Yeah, I've seen the good, what's the good
Good RX.
Good RX or good prescription. I think I've seen that before, but it's not. I don't have it popping up in ours. So we do have the medical portal has a prescription assistance category. So they're listed by state, which is a little, misleading because in many cases what you're talking about is that they work regardless of where they're physically headquartered. There are a couple in here, and there's one that's local to Salt Lake. So through the health department identifies pharmaceutical assistance programs for individuals without prescription. So they don't do it themselves, but they help identify. So that might be useful. But I like the idea of talking to the primary children's.
Sometimes if you go to the company directly, I know several of our epilepsy patients will go, I'll send them directly to the company and they programs.
Yeah, we've had that work on a few ones. And these are more the people that can't even make a copay on them. So
Yeah, I think that's a tricky one. I get this stuff in the mail all the time. I don't know if you guys do as well. Sometimes it comes in a BAL pack of coupons or whatever, and I'm like, is this worthwhile? Should I look into that or not? And you kind of feel like you're not sure if it's going to be a waste of your time and it's just a scam or something like that. So it's helpful to have recommendations about the good ones. But it does look like this particular website might be useful. So search by generic brand name or drug company. And then there's the Partnership for Prescription Assistance, which I think we also have. In here.
With my experience in that one is that they are more likely to help the patient has zero insurance. If they have some insurance, then they are more likely not covered, or they are likely not helping applying them with medication. So maybe something changed. I don't know. That was a couple of years ago.
Any other questions?
I think it's interesting how many, I don't know about you guys, how many of your patients, our patients don't realize they're supposed to shop around. Like they're so used to just going to their one place. I'm like, no, they charge differently. Go to where it price it out. And a lot of the time, like Costco and Sam's are really cheap, and you don't have to have a membership to use their pharmacy. And so I let families know you can go there, you can get this huge discount on these meds. Use it.
Maybe we should look into that a little more carefully and see if it would be appropriate to add those to our database.
Also Walmart is sometimes very good.
Yeah, and Walmart.
Some content. Okay. Anybody else running into some problems? Yeah, quick brainstorming session. All right, well, if you think of anything in the meeting,
Sorry, me again. Okay, so another thing that we have found that helps is that sometimes if you divide up the prescription in such a way that the insurance sees it differently, and does that make sense? Like, well, I'll give a basic prescription for, X amount of milligrams per day, and the insurance is like, nope, it's going to be, $500. And they're like, oh my gosh, well, okay, then we're going to get 6 pills at this many, and they're like, oh, okay, we'll cover it. It's the craziest thing. Or vice versa, right? They pay per pill, so that so there's lots of ways, I don't know, that we tried to finagle. Not that helps with a copay necessarily, but
That's kind of fascinating. I mean,
it's crazy world pharmacy.
yeah. So I wonder. I mean, has anyone else run into that? And are you comfortable in with your knowledge level and in your role to be able to try and work some of these angles a little bit and work with the prescribing individual to write the prescriptions differently if need be? That might be.
I mean, a lot of times it's a matter of me telling our physicians, hey, this is great. And, I mean, I've done it for so long, but hey, this med is going to be much cheaper if we write it like that. So it's works out the kinks for that. So
how do you do that? Work one way,
Yeah. Is this something, do you think you could call the insurance company and just ask? Like, I mean, without having specific state, without specifically asking.
A lot of times where I've gone through, it's the pharmacy, like the pharmaceutical company or a pharmacist, who will say, we get priced at this and this and this.
Oh, okay.
So they're really helpful. They kind of say, here's a thought. And then it's just knowing. Sometimes I've talked to insurance companies, or when you get the denial letter back and it says, the family calls me and says, I'm now paying $500 when I used to pay $25.
That's an e-script, where they send you the medication, express script. I think it's the name. There's also certain ways you have to write that they accept it, and they also have very good prices. Providers are pretty good. What was my experience? See what is that way, and no problem.
So I just wonder, that's really interesting to me. I wonder if there would be a way to document that to some degree, more common options, more, I don't know. I'm sure it's hard, but I mean, you just keep this all in your head, or
well, in epilepsy, we use so many of the same meds, right? That it helps. Yeah. But I mean, then it varies, milligrams per kilogram, and each patient's different dose. I don't know if you'd be able to figure it out, like.
But you keep notes in their chart about it?
Typically,
okay,
yeah.
So that is one way for you to go back and see what you've done before. Okay. Well, we have a few more people who've joined us, so I'll just make sure, without putting anyone on the spot, that we don't move on without an opportunity. We're just doing our brainstorming, you guys, and we were going to move to our next part of the meeting, but if you have anything that was a particular, come on in, no worries, a particular barrier or causing you to not know what to do this last week or whatever, if you have some concerns, we can bring those up and see if we can't try and find them on the portal or find them from this group. And welcome. In fact, you guys mind real quick just telling us, whoever just came in?
I'm Carrie Nicholson from We Care Pediatrics in Layton.
Margie Olson from Utah Valley Pediatrics, Cherry Tree and Orem.
I'm Melinda Tibbles from Utah Valley Pediatrics, Tim Coffee.
I'm Mindy Butters, Utah Valley Pediatrics, Provo North.
Great.
And we had horrible traffic. So
yeah, was it?
Yeah.
I'm sorry. Well, thanks for at 7. That is really rough, isn't it? Good job. And there's a lot of awesome food, so don't hesitate to. Very informal. Get up and grab something to eat. So anybody on the phone? Jade's got a comment. Let's see. When she worked at the neuro clinic, she had patients who succeeded in getting free medications from manufacturers or through the Johnson & Johnson Patient Assistance Program. Okay. We'll look into that one. So going straight to the manufacturer, I assume that they probably all have a website that has a contact us link and probably some of that. So yeah, I think it's probably very important not to overlook something straight there. I like the point of trying to make sure patients understand that there isn't just the one way of doing things, and they should try and be advocates for themselves in that area. Great. Okay. All right. Well, if we're good there, let's go ahead and move on. Jump back to our PowerPoint. And Jade says, yes, and the U has advocates who can help navigate the manufacturer system. That's great. All right, well, I'm excited that we get to have Simone, I'm not sure how to say your last name.
Oh, that's okay. I get to go through it all the time. It's LaCay. Pretend that extra S is not there.
LaCay.
Or a C is not there.
Great.
So thank you for letting me come and visit for a little bit. My name is Simone LaCay, and this is Rachel Glauser. So the goal here is very simple, just to introduce myself and the services of outreach and find out really what feedback you guys have for us, how we can be of help. So outreach is very new, especially for the local piece. I've been in this role only for close to 3 months, and my director, Martha Davis, actually really wanted to be here, but she was on vacation. So I can't blame her for wanting to be in San Diego. So it changes a lot, but right now the 3 main areas that outreach is trying to accomplish is number 1, be a resource and an advocate for your families and your patients in your office. Just because everything has gone so digital that we've lost that connection, and we want to make sure that we provide that resource and that connection for your office. And secondly, one of the areas that I'm responsible for is providing awareness or increasing awareness for certain service lines, for example, like trauma or the Riverton inpatient unit in Primary Children's out in Riverton for families or offices who have, families who live out there, and imaging, So that's the local outreach piece. And of course, third but not least, there's going to be an out-of-state outreach piece. Martha is more involved in that. So we are having outreach clinics in Idaho, and we're looking possibly to go into Montana or maybe Alaska. We have an EP doctor who goes up there to Alaska once a month. So that being said, before I open it up for questions, for feedback, I do want to provide some. I do have some resources here for those who have not had a visit from us. We've got maps for your families to the main campus, so feel free to grab some maps on the front page and important numbers on the back page. And how many people here are familiar with the Navigator scheduling program that Primary Children's offers? Kind of show of hands. You are? Okay. It's sort of advertised, but not really. So Navigator scheduling, and that's why Rachel's here. She's the nurse with the Navigator program. So for your complex kiddos who have 3 or more appointments, because we know it's such a hassle to try to get your families coordinated and come here and be efficient. So we can help. We have schedulers that can help coordinate those visits. And it can be a combination of office visits or imaging or PT, OT, whatever reason you have to be here, we can coordinate that if they have 3 or more. Or for families who have children who maybe one kid has 2 appointments and the other kid has 1, and you're a stay-home mom, you want to try to get your kids here in an efficient manner, we can help you do that as well. So Rachel, on the back end, is trying to help coordinate what goes on, because as you can imagine, there's so many pieces going on with that. So she's here to be a resource with this program as well. And we're hoping to expand that service going forward, provide maybe more guest services, more plush, I guess, per se. But we need to make sure that there's resources put in place before we go forward with that. So with that, we're trying to be a resource and trying to, we do a lot of things really well, but unfortunately, as we know, we're not perfect. So I'm here to try to collect some feedback as to what kind of things can we do better, and if so, how can we help you with that? I know I've been able to talk to a few people.
Can I just ask a question back to that?
Sure.
So would that work best for one of the coordinators to contact the Navigator program on behalf of the patient?
It can be both, but it might be more straightforward to have the patient contact them, because chances are the scheduler needs to contact somebody to find out, hey, will these times work?
I'm wondering then the feedback to the coordinator of the practice, it would be really nice for them to hear back that, oh, we got it done, here's when it's going to happen.
Right.
So that's one, they would know that it got done.
Right.
How long it took to get done.
Yes.
But also now, when to be able to follow up on it.
Once the appointments are set, we send out an itinerary to the family that says where they're going and what time the appointment is, how long it will be, and then there's a little box on the two that says, when is your next follow-up, and then I have been sending out to the care coordinators who have patients that use the services.
When the care coordinator calls you to start the process?
That's usually when I reach back out to them. If the parent has gone straight to the scheduler, then there isn't that. So there's always trying to figure out how to reach back out to the CCT office. So any ideas would be appreciated.
I wonder if either you maintaining lists of practices that have care coordinators,
I do have a list.
and then you just automatically send it, or whenever you're talking to the patient afterwards, really trying to close that loop.
Right.
That'd be really helpful and kind of support each other.
That has been suggested before, and we're trying to make that a best practice. Right now, resources are just not quite there yet, but we're hoping to make that a best practice. So thank you for reinforcing that.
Communication is that the parents doesn't nail it that.
It depends on what the parent has, because some we have to mail an email if they don't have an email, or and some like it by email.
So you can email the expert.
Mhm.
So they have to log into it.
Actually, yes, it would be.
It could be sent to the Gmail or, I don't know about that.
Do they access anything through their chart, like the My Health? Through primaries?
My Health, like is
Out there, or secure?
Yep. That's a good point. Thank you.
Then the question comes up, if you're doing it one way to the patient, then you've got to do it another way, perhaps.
Right. Right. And these brochures you're free to take too, in case you need some for yourself or for your families. Any other questions or feedback in terms of what have you seen commonly in terms of challenges you see, communication, how's communication between primary children's and you as a care coordinator or to physicians? Because chances are you're taking on that communication on behalf of the physician. So anything we can do better? Anything you like that they keep doing?
Are you referring just to the scheduling portion or any other?
Anything.
So I just have a comment.
Yes.
So sometimes when they send a note, they don't actually send a note, they'll send a thing through Help 2 that says, Dear Dr. So-and-so, your note is now available in Help 2.
Right.
But if you don't access Help 2 all the time, like our system isn't Help 2,
right,
you don't get that note. And sometimes I'll see those and go, oh, geez, and then I'll go in and print the note out. But it didn't just come to us. I have to look for it.
Right.
So it comes to sometimes we don't get them.
Like your progress note?
Mm-hmm. Like if they've seen cardiology or neurology, it has I'm sure if the doctor went into his Help 2 inbox, it would be just jam-packed full.
Correct.
But
correct.
If we're not on that system and they're not checking it and we don't get the note.
Right.
So maybe just making sure that it does get faxed or something to the clinic, not just that little note that says, you know what note I'm talking about? They put on Help 2.
Just an alert to say, hey, your progress note is in Help 2.
Right. Yeah.
And we've brought that up. You're not the first one. I've had multiple comments like that, and we've brought it up. And right now they're in kind of a sticky situation because they're transitioning over to iCentra.
Mm-hmm.
They'll have that customization to say, hey, have that flag, send an email out saying you've got a note for in Help 2 or in iCentra. So we're working towards that. I don't know if it's something that can be solved right away, but maybe opting into paper faxes again.
Yeah.
Okay.
I think that's when you with that census,
Exactly. Right. So that piece is iCentra has the ability to actually send an email to say, hey, your patient may have seen this doctor. The progress notes are in iCentra. Because right now that alert is not coming.
But that's not
Okay, there you go. Okay. Correct. Obvious, yeah, okay.
So ours is always that.
Okay, just faxing, having the option of always paper faxing, got it, okay. Anything else?
Simone, on a follow-up to that, not just so oftentimes we'll get our initial visit, and you and I have talked about this.
Okay.
We'll get the initial visit via fax, and whenever we have a GI follow-up or anything like that, we don't end up with a follow-up visit via fax. So it will sit in Help 2 until
we happen to notice, oh, this kid's coming in, we're going to check Help 2, see if they've been in. Oh, look, they've been into GI 3 times. Oh, man, there's been some stuff going on with this kid.
Right.
And all of a sudden it's like, well, we could have been maybe helping do some of the preventative and management of this had we had a heads up that there was an issue. You know what I mean?
Gotcha.
So.
Okay.
I have a question. So we can log into Help 2 and see certain things. And one thing we're limited on is like imaging and radiology when those items are scheduled.
Okay.
And also dental. I don't know if are those being brought on to like the new around it.
It should. I don't know. Let me check. So imaging and dental. Are those the only?
And radiology.
And radiology. Okay.
Any procedure, more like procedural stuff. Our scheduling have a hard time. Are you able to see them either?
Yeah.
Yeah, I don't. It's not. Yeah.
Even if you're here and Help 2, you can't. I have to call.
Okay. Yeah.
But we are
I know.
Okay.
That's another thing with the scheduling piece. Like someone's already scheduled something when we don't know that they'd already started working on it, so we're gonna try and get access to be able to see all of it, so we're not gonna duplicate work.
And it's my understanding it's just services that are scheduled through Epic that we can see on Help 2. If they're scheduled like primary owns the service, scheduled through primary, that's the ones we don't see. So like radiology, dental. And you just have to, I end up calling them.
Yeah.
But if they're scheduled, you should be able to go into Help 2 and down to appointment. Is it appointment manager or what is the down towards the bottom, clinic schedule or something like that? Can you see if they have an appointment?
Not for
those ones.
But for the other ones, can you?
Yeah.
So I've never been able to do that. Is there?
I don't know that tab that you're talking about. But
it's
you can go into demographics, and
Yeah.
the next tab over is their schedule. So it's everything if they've ever been seen or if they have something scheduled. That's where you.
It's not always the most reliable though in our clinic at least.
Oh, it's not.
Yeah, not all the appointments will be in there.
Yeah.
And I think it's because we're not IHC.
Yeah.
We can't see that.
Oh, do you not have access to that?
We have. I Help 2 where we can go get like that put me in labs and stuff, but we can't see the schedule.
Have you looked into the demographic section?
Yeah.
You get demographic. That's it.
Oh, just the one.
Just the one thing.
What do you do with no-shows? Do you call the practice of the clinic if the patient is no-show?
We haven't run into that. We don't have a standard process to fix that. So the kind of complicated cases that we're trying to figure out what to do when that happens. Trying to figure out why they're no showing.
You don't go back to the care coordinator and talk to them because
I
might know that
actually the one complex that we have. I'm actually going to call it today. We need to figure out because it keeps happening, so we don't know. Brainstorm. If you guys have any ideas, that is a major one.
Navigator. I don't know.
Navigator, and I don't know.
Yeah, like the care coordinator and the different departments. We'll look into that. There's, as you know, certain departments do things very well and very efficiently, and certain departments are just so big and complex that there's room for improvement. So we're trying to see if there's a way to streamline things a little bit more, but you can imagine that's a big shift, trying to change that direction. But we're chipping away at it.
Oh, I would just say that now that, if I understand correctly, everything at Epic kind of goes through like a centralized scheduling.
Yeah.
I don't know if there's like any kind of like tools or flags that you could do, but in Epic there's like things that automatically get routed to like work queues.
Okay.
I don't know if there would be something for like a no-show work queue that can be created and then someone like in an inbox and centralized scheduling could potentially take a look at that.
Okay. Good suggestion.
We try to do some flagging. There could possibly be like a DARS report or something.
Can we? Okay. Okay. All these are, as we talk about system issues, we've brought this up continuously, and the problem or the slight challenge they have is right now they're going to transition from Help 2 to iCentra, so a lot of things are being put into focus to try to make this iCentra
unfortunately, some of these things may not be addressed right away because they want to make that work in iCentra because it's challenging, as you can imagine, to put money into a system that they're not going to be using in a year or two. But those things are very good feedback because we want to make sure when we create this platform that it does have that capability. Yeah. Yes.
Another question or comment. I don't know if these items change so much that there's not a way to maybe present information on it, but like what services are available down in Riverton and on what days?
Yeah.
Because sometimes we'll talk to the family like this is an option, and we'll ask them about availability, and then go to schedule, and it's like, oh, we only have it on Tuesdays. So there's like knowing like what days the specialty clinics are down there, and even here too, I guess, because sometimes certain things happen on certain days.
And we're creating that piece for the Riverton one specifically. Yes. Athena, where are you again? I'll make sure.
University Pediatrics.
Oh, okay, okay. So yeah, because make sure you have my contact information in case you do request certain things, because we have that piece coming out. So I don't know if that piece will just be downloadable on the website. I may have to deliver it, so make sure that you get my card so that you can tell me you need that. That's a good point. Anything else? How much time do I have? I want to be respectful of your...
You can take a little more time.
Okay. Anything else? Well, if not,
I have one more, sorry.
Please.
So in reverse order of scheduling, if we have a patient that needs to get in, that's like, when we look at the notes, say for comprehensive care clinic, they're supposed to come back in 3 months, and it's been like 18 months, like that we can see, and we can't get a hold of them. Is there a way to contact you guys and say, hey, they were supposed to be seen, and we're worried that he's falling through the cracks, and can you help contact? Is there somebody to contact for that? Okay, and you'll have your
you can, we'll put her name, or you can take my card and I'll forward you her information.
Okay.
But we'll get Rachel to.
Sometimes if you guys call, it's a little more.
For sure.
Benefits us.
At least and that's why we're here, to try to be your bridge, your connection, in case those things happen, where the protocol is deviated. Okay. For whatever reason. Okay. Yeah. Cool. Okay. Well, thank you so much for having some questions in chat.
Yeah, I listened before. I don't think that we're anyone on the line have any questions for our outreach folks before they take off? Well, that was really helpful, and we will make sure that their contact information comes out with the resources of the month email, so they can contact you guys directly, right? Yes. Is that all right? Okay. If you have other questions come up. So what I heard is that technology is a pain.
Meant to be helpful.
Yes, it's supposed to help, and I know it does in a lot of ways, but a lot of these things need to get worked through. So.
Exactly.
And what's the time frame for getting on? Is it iCentra?
iCentra. We don't have a actually proposed go live date yet. We're thinking within a year or two, Rachel?
Yeah, I was just happy to hear about this.
Sometime next year.
I don't want to do it within respiratory, start it within respiratory season.
Yes, that's a good thing. We want the bugs to be all worked out as much as possible before they transition here. And that's the hope. I know that they went live in Logan and the North region, and they're just trickling down. So Primary Children's is its own region in the Intermountain system, so we get the flexibility of setting our own date, which is nice. But we're probably looking at a year out.
Okay, well, thank you guys.
Thank you for having us.
That's great stuff. Yeah, by all means. Yeah, definitely. All right. Okay, so we're going to move to our next part of the meeting, which is to show you the medical home portal, which we've tried to do, I think, 2 other meetings, and snowstorms and other things got in the way. And the timing's not bad necessarily because we have recently had an overhaul. Let's see if I can get my screen to work. And so we've got a little bit of a different look to show you, and some new features that we're really excited to show you. Here we go. All right. Okay, so first of all, how many of you are familiar with the medical home portal? I like seeing that. Wonderful. So obviously we refer to this every meeting, right? So you're at least somewhat aware of it. But Medical Home Portal, and forgive me if this is in fact a redo, but it is a website and a service that came around a number of years ago after Dr. Norland had done a survey of Utah pediatricians as part of a project that was going on with the Bureau of Children with Special Health Care Needs to really ask them what would help them better care for these kids and have better outcomes. And so he said overwhelmingly there were 3 things that came out of that survey, and one was that they needed to have up-to-date practice guidelines and information on how to treat some of these more complex and chronic cases. They also wanted to know about local resources in their area to be able to connect the families to those things that they needed. And finally, there was a desire for care coordinators in their office. So as far back as 1998, that was being recognized, and it's so nice that finally that seems to be, coming to pass. So Dr. Norland at that point in time knew he couldn't do the care coordinator part of it, but he thought, well, maybe I could help with the other 2 things. And so that's how Medical Home Portal was born. And originally it was, some practice guidelines, and then actually a printed list of resources that they worked on for about 6 months. And then about 2 months later, after they distributed, half of the stuff was out of date. And so they realized, well, maybe this idea of this internet thing, this web thing, maybe that's where we should put the stuff so we can keep it more up to date. And thus the Medical Home Portal was born. And so it's gone through several iterations, and this is our latest one. And so I won't take too much time. I really encourage you to take some time yourself to look through here. It's a big site. We recognize that in some ways it's too big, it's overwhelming, and so we're working to make it more easily digestible, both for you and for the families, and particularly in that area that's specifically for parents and families. It's got a lot of information that can be just a little bit too much when you come into it that way, but we're working on making it more accessible and more to the point for whatever they're facing at that moment. But we do have a lot of clinical information on here that we want to make sure that you're aware of. So the first 2 sections on the left of the header here are written really specifically for the primary care clinician and team. So they're written at that level, but of course anyone can come to the site, and we know that families do come and read this information. And currently we have 45 conditions in this section. You can see them here on the left. And some of them are a little more common, so that you'll be certainly more familiar with seeing these kinds of kids in your clinics: autism, asthma, depression, ADHD. But we also have some that are fairly rare. And the whole point of this is because we understand that when one of these kiddos comes into the clinic, you may not have seen a case like this, maybe ever, or maybe not for a long time, and certainly the clinician probably not since medical school. And so what do you do, particularly if you're trying to be that medical home and provide good care to that family? So that's exactly what these are for. So maybe we'll take a quick look at, let's look at Prader-Willi. This is definitely not a common one. Each one of these, we call them modules, has a set of sections with comparable information in each section depending on the diagnosis. And so there's a description and there is prevalence. So Prader-Willi syndrome is about 1 in 25,000 is the frequency that would occur. A little bit of information on genetics, if in fact that's applicable. And it definitely even talks about the role of the medical home for that particular condition. And then if there are practice guidelines, they're here. And any kinds of literature that we're aware of and feel are appropriate are listed here, and then also in the bibliography at the very end. So there's an assessment area that helps the clinical team to make sure that this is in fact what they're looking at. So this is something that could be reviewed periodically as is appropriate depending on the child and the condition. So some screening information. There's also information on differential diagnosis, some history and examination testing that might be relevant. Whenever there are body systems that are, in particular relevant for that condition, that's pulled out and made specifically referenced in there. And And then the section that we think probably gets used most is our treatment and management section. And as you might be able to tell as we're kind of scrolling down, this is not surface level. So we have experts that we reach out to write these and to then keep them up to date. They're peer reviewed by other experts. So they go through quite a process to be written and to be maintained. So we want to make sure that this is in fact excellent, up to date, appropriate information so that it can be considered a source to go back to time and time again. The pearls and alerts I think are particularly interesting because these come from experts who see a lot of these kids, and they are in fact the things that might be missed by a primary care physician or someone who's just not as familiar. And so it's really nice to have those in. They may not be in a regular textbook kind of a thing. And then, of course, we also try and make sure that whenever we are aware of specific resources and services that would be relevant to Prader-Willi or another condition, that we list them here. So in our resources section, of course, in the vernacular of the medical home portal, resources really would indicate like a website, a link, or maybe a downloadable PDF, something that would be accessible to you anytime. And it doesn't matter where you are, that would be relevant to you in Salt Lake City or in Washington, D.C. or on the other side of the world, that kind of a thing. So those are listed here. And then as we scroll down a little bit more, this section also includes clinical tools. So if there are checklists, growth charts, assessment kinds of forms and tools that are relevant for this condition, then we try and gather them here for the clinical team. And then we have a similar section that's really intended to be focused for families. I'll come back to this link in just a second. This one right here. And then a little bit below that, we have all of our services that are pulled together. So throughout the module, we try and indicate, again, this comes from our experts, if there is a certain kind of subspecialist that they might need to see throughout their lifetime with this condition, if there's a certain kind of community health or human service that might be particularly helpful, or even just more generally helpful, we try and put that information throughout the module, and then we aggregate it all here so that you can kind of at a glance see what we and the experts might recommend would be the services that this family might need to access over time. And as you can see, if we know of studies or registries, we also indicate that information there as well. So you can kind of take a look quickly at all the things that might be appropriate for a child and a family with Prader-Willi. In some cases, it'll be a long list. So that's kind of a quick look at what our module looks like. And then I mentioned a link that I'm wanting to show you. I'm going to go a little out of sequence here, but I think it's relevant. So our family diagnosis page actually takes you to our For Parents and Families section. So we link back and forth between these two parts of our website, because within the family section, we largely have kind of more general information that's aimed to help families as they find out a diagnosis, or maybe even if they haven't yet, to kind of understand what's ahead of them, what assistive technology, dealing with transitions, trying to figure out the school stuff, early intervention, those kinds of things are there, but kind of in a more general way. This area of the family section is diagnosis specific. So we actually have a page written for families for every one of the conditions that we have the more in-depth clinical module on. So this is written in a FAQ style, and basically it helps kind of break down what we found to be the most common questions that families who have a child with a chronic or complex condition, the questions they ask. And at the bottom of these, not all of them are quite as fleshed out, but we're working to make them all consistent. We again have resources listed there for families, and then the services as well. So now I'm going to quickly take you to our newborn disorders. I won't spend too much time on here. This section consists of kind of a one-page quick look at each one of the newborn disorders that are screened for in Utah and most states. So what it's intended to do is really help the primary care clinician and team understand what to do if they get a notification of a positive screen. So again, some kind of orienting information at the top, and then quickly we get down to understanding what to do to follow up on that positive test. And we link to the Utah Newborn Screening Program, and this would be similar for any state that's working with us. It would link to their newborn screening program. So this is specific to Utah. And then again, some information that would be hopefully helpful for the physician. And when we have the ability and experts again to do it, we try and make a full clinical module for each one of these conditions as well. So in many cases, you'll see all that information to help manage and assess and treat that condition for the child over their lifetime. So that's kind of that clinical stuff. And then over here in the center, we looked very briefly at the for parents and families section, but we also have kind of a similar section for physicians and professionals. And in this section, we have information that includes building a medical home. And we are working on expanding this information right now, particularly our care coordination page or pages. So I definitely wanted to show you this page. It is being worked on right now. We would really love it if you have the time, if you wouldn't mind taking a look at it and giving us a little bit of feedback. Right now it's a fairly long page. We don't know if we should continue to add information to it, or at least take the information that's there and maybe separate it out a little bit so we end up with multiple pages, or if we should just reduce it down. We don't want to overwhelm with information that's not helpful, so we want to try and find the sweet spot or sweet spots, and understanding what you think would be valuable on a care coordination page or set of pages would be super helpful to us. So we certainly want to include tools, examples, forms, those kinds of things where they're helpful. So we've got some things in here already in terms of care plan examples. We've listed a number of the things that have come out of meetings here already on the bottom of this page.
Yeah. I may have missed it at the top. Is there already a section where it just lists these headings where you can click and it'll bring you right down? Or?
We are working on that. That's something that we want to do for really all of these types of pages, not the non-clinical content pages, and we want to take every heading and put a little table of contents at the top. We think particularly with for family pages that would be very helpful so that you don't have to scroll through everything and go right to the section that you're interested in. So
yeah, that could be used independently or in combination with just having each section collapsed that you can click to expand.
Cool. Okay. Great.
You probably thought of that.
We have so there are a couple schools of thought on the collapsing features and some technical things that go along with that, particularly as you try and make your website work for smaller screens, that kind of thing. But what do you guys think? We would love to hear your feedback. What do you think of sections that can collapse so that you can kind of overlook them if you're not interested at that point in time? Any strong feelings? That's a good idea.
I like them. I think it cleans it up because then I can close a section that I'm not interested in and it won't distract me.
Great. And again, as I was mentioning down here at the bottom, we have listed some of the things that, it's a long page, that we've talked about in prior meetings of the UCCCN, and we will continue to add them there. I'm hopeful that we can use more of a table layout because a lot of these are just kind of this block of text, and for me personally, my eye, I start to not be able to differentiate between them as there are so many of them. But as you can see right down here, we talked about each of these in past meetings. I'm also really interested in putting together basically a page that would just be less content and more of these kinds of links and downloads and those kinds of things. And they would all be separated and categorized so you could go to something quickly, whether it's kind of more of the curricula about being a medical home or doing care coordination well, maybe with measures and so forth, or if it's more of an individual tool that would be of use within a practice, the pre-visit assessment questions, for instance, something like that. There are a lot of webinars that are being done. Some are maybe more helpful at the practice level than others, but we list those as we're aware of them, and you could typically they'll be archived after the fact. You can go and watch them anytime that you're sure, so we'd like to list those. Would that be a value to you guys? And we have the recordings from these meetings on a YouTube channel, and I want to link to those as well, although those are a little more specific, and this is a page that we would anticipate being accessed by, folks outside of this group and outside of Utah use. And so we're kind of trying to figure out how to make things maybe more Utah-centric and more this group-centric, but also present information that would be generally valuable. We're working on that, and we would love your feedback. We love your ideas. You can just email Hay or myself at any time. And each page does have a feedback link at the bottom. So this right here, that comes right to us. So that's a pretty straightforward way. If you're on the site and you think, oh, I think I should tell them about that, you can do that right here. So in addition to the care coordination and medical home section on here, we have a little information about working with schools from the kind of point of the health professional. We have some medical technology pages that we're going to be adding to. So we've got some information on, for instance, feeding tubes and tracheostomy. So this would be kind of, general understanding of care and cleaning and so forth. We've got a page on wound care that we're working on right now. This is where our screening and prevention information is. You may have seen some of these. So we have a few there. Maternal depression screening was recently updated. We've got prevention of TBI. We have some transition information here. We also have quite a bit of transition information on for parents and families side. And as we are aware of them, we have a health supervision guidelines page. So we just add information to this, largely genetic based information right now. But as we're aware of it and it becomes available, we add that here. And then I'm going to quickly jump to this last tab, other resources. So we mentioned that when we say resources on the portal, that really does mean typically a website or something that's static, a downloadable page, a PDF, something like that. So you can search for those here, kind of based on what you're looking for. You can certainly always use the search bar up here as well. But if you come in here, you have some other options. You can actually search by the diagnosis module if you're looking for something quite specific, or you can put in a more general term here or a specific term here and simply hit search, and then you'd be able to see what comes up in the 207 resources that are categorized that way in our database. And again, tools for the practice, 328 have been indicated as tools. We include registries and studies and the bibliography information as well, but our largest group is the information support. So this would be considered a little more general. In some cases, of course, it'll be very specific to the diagnosis. But again, a lot of these are websites that we feel are of value. We've looked them over, and we've done our best to make sure that they're still out there. And if they're not, tell us, and we'll sort them. So then the services directory, and of course I'm excited about this because this is, if you came to the practice managers group meeting last week, we talked a little bit about our services directory there and the list feature that we're really excited about and that I want to show you next. So we have, wow, I should have looked before we came, but we're, I think, over 4,000 service providers for Utah in our database right now. That includes community, nonprofit organizations, and we get that information from 211. We partner with them, and they gather that and for the state of Utah, and we pull from them on a regular basis what we think is relevant to this audience. But we also then add to that professional organizations, and so that can be subspecialists, that can be therapists, that can be other kinds of health professionals, or more for-profit organizations that we think are, again, of value to families and those who care for children with special health care needs. So we do have them all categorized by categories that we came up with at some point in time with help from families and other professionals. They may not be ideal, so you can also search by term, and we are working to improve our search options so that you really can find more easily what you're looking for. So know that that's continuing to be developed and improved. But so you can just browse at a glance if you'd like here. And the numbers on the right of each one of these categories indicate how many service providers we've got in our database. And you will see that we try and look at these first by state and then by city. And we know that that's not always ideal for how you're trying to search, so we're working to present the information in a number of ways so you can sort and filter by what you're looking for. Sometimes you're looking for something in the city that your family is located. But other times you're just looking for the thing, right? So we are aware of that, and we'll continue to work on that.
Are you going to make it based on zip code? Like if I put in the family zip code and it'll pull up a certain region?
Yeah. So eventually we'll definitely have the zip code feature. We'll also have an age range feature that in some cases won't matter, but in other cases will. And so that will help to reduce down what you're looking at. And then if something's diagnosis specific as well, then that would help to further refine that down. So there'll be a number of ways of kind of coming at it. And so right now we hope that this is of value, but we know that it could be of more value if you find something or some things that would be useful for a family in the circumstances they find themselves in, you know, that week, that month, whatever it is. If you would be able to hand those to them somehow, get that set of service providers to them. And so that's what I showed briefly the other day at the practice managers group. And so again, forgive me if this is a redo, but we have made a few changes since that time that I think have improved this as well. So as I mentioned, and as I showed you a little bit in some of our content pages, we actually have links to our service categories there because we're trying to indicate to you that, you know, if you've got a family who's got this particular issue right now, this set of service providers could be of value to them. If you've got a family with this condition, this subspecialist or this set of service providers might be useful. You can also just go straight to the services directory, but kind of a number of ways to get here. And so if you're logged in, as I am, and even if you're not, you can do some of this as well, but you get more options and more features if you're logged in. You have the ability to put together lists. So I went ahead and I put together a couple of lists to be able to show you here. And so let's look at the homocystinuria list. I put together 11 providers, and what I did is I went through and looked at that diagnosis module, and I just picked every single service category that was in there, and I pulled out one based on, for instance, the location, generally Salt Lake City. So I have 11 in here, and as you can see from the list, I hope you can see, that the service category is listed at the top. It's clickable, so if I want to go back and see what other service providers are in that category, I can. And then you can see a bit of information here, and if you want to see more, you can expand that, and then you get a little bit more information that may have come from 211, or it may have been something that we put in ourselves. You can click to go to their website. You should be able to get a little eligibility information here, and you can see when this was last updated. You can also see if this particular organization provides other kinds of services as well. They will be listed in this section here. So 11 might be too much, but perhaps this might be something that you would keep as the care coordination person in your clinic or practice. And then you've got a family who comes in and maybe they've got a child with homocystinuria, and some of these things aren't relevant to them today. Well, we'll just get rid of those. So maybe this child is past the age of 3, so we'll take that one off, and that one off, and maybe genetic counseling isn't something the family needs at this point, so we get rid of that, and then we can refresh. And now we've got 9, and at this point, I would be able to do a number of things. So if I wanted to, if this family was someone who didn't really use the internet very much, we would be able to print this or save it as a PDF and then send, you know, in a certain way. We could print it right there, do a number of things, and just literally hand it to the family if that's the best way to do it. And we'd like to ask you some questions about what would be beneficial in your mind in a printed version of a list of service providers. So I'll come right back to that. Additionally, if this family is more, they have a smartphone or they, use the internet more and prefer to have things emailed to them, do things more electronically, then at this point you can simply share this list, and then you can grab the link to it. So I would now copy that, and I could plunk that link into an email and shoot it off to the family. And on their end, when they get that, they would be able to see what you're seeing here. Now, they wouldn't be able to edit it unless we gave them the ability to log in, copy it, and then make changes to it as they chose. So we've got a lot of levels of things that you can do here, from kind of real basic paper-based sort of thing to starting to be a little bit more complicated if we want that. Perhaps they know other parents who have children with the same condition, and they would want to share this list as well. So they would be able to do that as well. Anytime we update our database with new information, better information for these particular service providers, the lists get updated so that they stay as up to date as we can make them. Eventually, we'd love to be able to take input from you guys as well and kind of make it more of a two-way street. So that's a goal down the road, that if you learn something about a service provider on one of your lists, someone that you use frequently, that would be beneficial for the portal to know and other users to know that we'd be able to take that feedback and incorporate it as well. Again, down the line, we'd also like to be able to add other kinds of information to these lists so that they weren't just service providers. They might have some of those resource links that would be of value, and maybe even a little bit of text that would be of help to the family to kind of orient them to what's going on right now in their child and what the list is really about. So that, that could be one of those pearls and alerts that I mentioned to you. That could be information from the transition section of the portal that's helpful to their child who's just about to go to middle school, some things like that. So again, I wanted to ask a couple of questions. As you can see, when you've got a longer list, it can start to get a little long. And so one of the questions that we'd love to ask is, how much information is enough? What would you want to see when you're printing out a list or planning on, getting it to a family? Is this too much information here, what you see in the heading and the yellow box? Is it not enough and you'd want to have it expanded? That would be a lot of paper, right? Would we want to not even have maybe the address information, or to put some of this on the same line so it gets even more reduced and you can get more on a page? What do you guys think? Of course, you're in control of these lists, right? What's that?
The address is really good because then you can kind of see where they are.
Right, exactly. Yeah.
Would you be able to, like you just expanded one section, would you be able to print a list with only certain sections expanded?
So does that look like it's about the right amount of information? So again, one of the things that we have to keep in mind is that the printing can be done differently than what you see on the screen, but we are trying to make it so that if someone's viewing it on a tablet or a smartphone, that they get enough information as well. So we're kind of working to meet all of those things at one time, but particularly for the printing, I think we have a little bit more flexibility to be able to move information around a little bit and how
Can you go back to the printed one?
Sure. I don't know if you can really see that. Let's see if I can pull it open a little bit. That go bigger? There we go. So,
are you able to make it more service-oriented in the sense that it doesn't have like all the tabs at the top? Or I mean, this is directly a print page, right? So it doesn't like have the top, this stuff here. Right. So it's really just an information sheet.
Maybe we would have the name.
Or maybe allow us to title it.
Differently, maybe. Yeah. Okay, those are some good ideas.
Is there any way to allow for like putting something in to print, like if you had special instructions or something that you were putting patient specific, like you were printing a page but you had patient specific information that you could text in there and then print it out?
So you could like copy paste something into it.
Yeah, or if it was like, just something you could, if you were
actually,
put instructions.
You know, I don't know, but maybe.
Okay.
So it's a great idea. So then you're really personalizing it.
Mm-hmm. I would think one at the top, or that you could.
The other thing that looks like it takes up a lot of space is where it says what category it's coming from, and I don't know if that's necessary.
We've heard kind of a couple of different thoughts on that, and so I wonder if maybe there could be some optional information so you could, I don't know. I know that, to some degree we don't have the ability to do everything we want when it comes to printing. There are some, things you have to, some restrictions you have to work within, but that's an interesting idea. Only keep what you want in there. Okay. We also talked about wanting to give clinics the ability to even maybe put their logo on there as well. I don't know exactly how automatically that could be done. That might be more time and effort on your part, and that may not be worth it. But so if nothing else, what we'd be looking at is to try and get rid of all the extraneous stuff and be able to just show what's important to the family, and then also to maybe have an area where you can enter text, enter information that's specific to them. So I guess the one thing that I would be a little concerned about there, but maybe if we're saving it as a PDF, it's less of a concern, is because at this point in time, what we would print has no pH bias, right? So what you see on the screen is good to go. But at the point in time that we're putting patient-specific information in there, that changes things. So if that's in a printed fashion, then you would save print, and that could be PDF or whatever your environment supports, and then that can go in the chart.
Or if you're giving it to the patient right then and there, you're not saving it or.
Right, at that point, yeah.
And the logo idea is awesome. Mm-hmm. Our company would like that idea.
Cool. Okay, well that's really helpful.
One more question for you, sort of not related to this, but children's special health care needs still called children's special health care needs? We got a phone call from somebody that wasn't happy that we sent a fax. So that's not who we are anymore. Did they change their name? Yeah. That's what it was. That's rude. They call.
Yeah, like I do have a new number that you can call in the fax if you guys want it. So it's 587-2255. Oh, yeah, we'll email that. Perfect.
I called there yesterday to get more information, and Children's Special Health Care Needs is not scheduling anymore, and the new one is not scheduling yet.
We're not.
Have it set up.
But now that we have contracts in place as of yesterday, we can start the schedule. So if you have those, I would think within like the next week to 10 days, we can actively be scheduling them.
Okay, yeah. Okay, they just said when I talked to them, yeah, they're not getting it as templates. So they said to call back in the middle of July. So you can either call, parents can call and they'll tell the parents to call back, or you can just
They actually make names and contact information, and we'll proactively call everyone as well.
Is that the child development clinic?
So child development, and then also need to go follow up.
Okay. So we can't schedule any of those till July.
We're in a hold.
Okay, we can have the update on the official kind of this is the protocol to do in the next few weeks, and we'll send that out with the information to everybody so you know what to do in there, like cameras as well.
That would be great.
also, I think it's worth mentioning that the Bureau of Children and Special Health Care Needs is not going away and are still involved, especially in the school care coordination piece of things due to some grants that the Bureau has going on. They will not be involved, though, as I said, in clinical activity. So we've heard that there's no more Bureau of Children with Special Health Care Needs, and there actually is, but it's just not in the clinical.
And that's one of the goals is to somehow enhance your ability to coordinate care and interpret all the connections you make and how that can happen. So that's the stuff that a lot of people forward. How can that program, having the grant really support
Yeah, good questions and timely information.
I have a question with the new clinic. They'll be keeping all the things as it was. Is that correct?
Correct.
Okay. So kind of jumping back real quick to the list, what we're looking at right here is the development server that we use for the Medical Home Portal. It's available if you're interested in doing this now. It uses the same database, same information, so you're not getting old or bad information. If you were interested in using this, just shoot me an email or a text. We'll set you up with a username and password, and it's pretty straightforward. If you have any questions on how it works, we'd also be happy to kind of walk you through it. So yeah, just let us know, and of course, if you're willing to do that, we would love to hear any of your feedback to try and improve it, because this will be something that we're going to continue to work on and improve even after it's on our production site, which we hope will be soon. So we hope that you'll take advantage of this and continue to help us to improve it. That's what we want. We want it to be useful to you guys, to your families, to your clinic.
Every once in a while, changes.
That's right. And we can also let you know that in advance, but it's usually pretty quick. Good point. All right, so we wanted to also let you guys know about the survey that we've been bugging you about, the questionnaire that we've bugged you about for months now. Thank you very much to everyone who responded. So this particular questionnaire, we actually put it together based on another less lengthy one that didn't give us what we thought would be all the good information that we'd like to gather that would help us understand where you are individually and where your practices are at with regard to medical home types of activities and certainly care coordination within those clinics. And so we did see some gaps and some opportunities that we think we can try and work to address in this network and this community. And then we also think there are some answers and some information that might be of interest to your clinics as well. And we're very happy to show this to you and to make that available to you. I'm just going to take a couple of minutes right now and kind of show you quickly what the results look like. So there were, it was not the shortest questionnaire, so I won't go through each and every one of these. There were some really interesting things. So where you see, this kind of some do something and some do another thing, that's kind of interesting, and it might be something that we'd like to follow up on and find out if those who aren't doing that thing would like to do it, and if we can help with that in any way. So, if you're not able to see it, sure. Let's see what we can do. I can even go bigger if you don't care about that stuff on the right. So this asks if the care coordination position description has been established, and most of you guys who responded on your organization has done that, but some have not. And so maybe that would be something useful going forward. This question asked about training or a degree required, so there's some differences there, and that's kind of interesting as well. There are comments in here as well, and those sometimes provide the most interesting information. And again, I can make this available I can just send it out to the list in an aggregate form that includes all the questions. So I will do that. And if you're interested in seeing your own answers, we have those here, but I'm not going to include that in the thing I send out. So if you want to see your own, we can make that available to you if you want to kind of see how that compares with kind of aggregate. Probably shouldn't have clicked away. Now I'm on page 7. Let's go back. How the roles are articulated. This was interesting. Principles that guide the practice and care coordination. Some, not sure if that would be something that we should spend some time on, and we'll ask about that. So this was an interesting one. So at the point in time that people responded, the practice was largely not billing, so I think we'd like to spend a meeting, or at least part of a meeting, talking about billing. And I think that is changing to some degree, and so maybe we can provide some insights to each other on how some practices are trying to work through that. So this got a resounding yes. They are providing comprehensive information about local services and resources, and so of course that's very interesting to me, and we might want to drill down into that a little bit more and understand more about how practices are doing that. Of course, we always hope that the medical home portal can help with that. This is a resounding yes. Everyone's receiving families with referrals. Great. Similarly here. I would like to get into the weeds of this one a little bit more, perhaps at a future meeting, on how is the communication being facilitated, because that's such a big deal, right? You have that whole conversation just here. How do you do it? So maybe you guys have figured it out on your end, but what about the other subspecialties and other follow-ups and things that you want those families to do? How do you get them to communicate? What's going on there? So again, communicating with schools. So that would be a similar set of questions. I would really like to understand how that works best. So most are assisting families with insurance and funding issues. I actually did put together a list that I didn't show you on some of the funding organizations, those that help with a variety of assistance types, whether it's actual money or helping to provide something else that a family might need. We have those in our database. Working with insurance-based care managers, pre-visit calls, we had kind of half and half there, so that was really interesting, and we did talk a little bit about this at one of our previous meetings. And that, we've talked about that as well. Here's care plans. Not everybody's doing care plans. This is a big deal. In care coordination, this is one of the biggest components. So we might want to come back and spend a meeting really talking about how to invest in care plans. And it's not only about developing and updating them, but it's really about that implementation and follow through on those. And again, a big part of that is the communication piece, right? Assessing patient and family skills. So this kind of gets into doing a little bit more of that hands-on self-management kinds of things. And so a lot are doing some, but some are not. And then this is, again, this kind of some of that communication and care plan follow through. This is a little more of education for families, more specific kinds of information, maybe the education components again here. Not everybody's doing that at the same level. Everyone's advocating though, and that's fantastic. Matters of medical necessity, tracking down clinical information, so I touched on that today. And then tracking referrals, similarly. So this is kind of that quality improvement that we've touched on a little bit before, but we're planning on doing more of in an upcoming meeting where we'll talk a little bit more about patient registries and population management. We'll have the Utah Department of Health asthma program to talk a little bit about how to do that around asthma in particular. Patient registries. And So documenting care coordination activities. Not everybody's doing that, and that's not an easy thing, right? That's time, and that's having the right system and all of that stuff. So we might spend some more time on that. And this one, there's a phrase that precedes a set of questions, and I can't quite remember what it is, but it basically asks, do you provide this kind of a service? I think so. This would be in person in conjunction with visits to the clinicians, or in person when they are maybe not seeing the clinician for that visit. So this kind of looks to see how you're actually doing care coordination within your practice, and that might be different from how someone else is doing it in there. So a lot by phone, come through electronic communication, and then that raises those questions again about HIPAA and security and all that stuff, right? And then other ways as well. And we've got responses that help explain the other ways that they're doing it. And then this talks about roughly how many times you've interacted with somebody. So we see some different numbers in there. Per day, 50 per week on average. So we need to kind of look at that a little more carefully to do a good comparison there. Here's an interesting question about a patient portal. Is that a good way to communicate information to them? So less than half have that or use that. It's kind of interesting. Here's the secure email that was mentioned earlier. More than half there. Do we ask families for feedback about their experience as well? Some do, some don't. And then a few more questions. So I'm going to wrap that there because we don't have time to go into each one of these. But I'll send this out. And then if you would like more specific information or your own individual information, we can probably provide that for you as well. This is something that we'll probably come back to down the road a little later. Maybe ask you guys to do it again and take a look at how things may have changed in the time that you've been coming to these meetings and in the time that we've been working to support you on that.
Also, one of the interests that also nationally is developing is understanding what are best practices and how to do care coordination. So that's something that, looking at your responses, there's a lot of experience and skills that developed amongst you all that we'll be thinking about what would be the easiest way for you to talk about it and develop understanding of what are the best ways to do that, to do it efficient and effective. Those are the ways to do that. So if you're willing to help us with that, that would be a tremendous contribution to what you do, because you can have a shareable issue, but also with the national level. How have we learned how to do that here? Practically, still a relatively new thing.
So here are some of those things that came out of the survey that we noticed. But for those of you who did attend the practice managers group, rather who didn't, we had the opportunity to talk about medical home portal and this group at a meeting last week that the Utah chapter of the AAP put on. And there were practice manager types there, more administrative, but there were also quite a few care coordinators because the topic really was about patient care coordination. And there was an evaluation that came out of that. Everyone was invited to fill out. And so I got this email that these were the things that were mentioned on those evaluations. So lots of ideas that we might be able to pull into some meetings through the UCCCN. And so we'll probably be polling you for thoughts on which of these we should maybe kind of bump up and put more time and effort into. So that was great. We really enjoyed being at that meeting, and these are great ideas that we're totally going to follow up on. So we'll wrap it up now. Oops, what happened? Checking for updates. There we go. Gabby, do you want to take just a couple of minutes and talk about the follow-up that you are doing?
Well, actually, I have not much to say because the care coordinators on the medical home project from last year who are here, they all submitted their data already. So thank you for doing that. Hopefully, we can follow up with you soon to give you after 6 months, we'll start with the data. I'll report back. Thank you.
And so we were just talking about future meeting topics. These are some that we are definitely planning on doing. So I don't necessarily have a date coming up yet, but soon these will get all pinned down. So the Utah Office of Home Visiting has expressed interest in coming and talking with you about that program and asking for your ideas on how best to work with care coordinators. And so we think that will be a great opportunity to trade some ideas back and forth and see how to improve on that. So Shriners has offered to have us come and meet there and do a tour of their facilities and have a presentation or two around some of the services that they offer. So we're excited to take them up on that. We have, or as I mentioned, we'll have patient registries and asthma management as a topic coming up here in the next couple of months. And then we have a couple of mental and behavioral health projects going on. I will look forward to sharing the information that we've learned from those with you guys, and also some of the actual tangible outcomes that will come out of those. And so we're hoping, although it hasn't been pinned down yet, that we would actually also get Intermountain to come and talk with us about the behavioral health services that they provide at that meeting. And our next meeting is on July 21st, and it will be in Doty. So we'll make sure that that's clear when we send out information about that, and that's July 21st. And of course, the Resources of the Month email will be sent out with all the stuff that we talked about today, including some of the changes with the university taking on the Children's Special Health Care Needs clinical aspects, the information that we heard from Primary Children's with their outreach program and the Navigator program. And we'll talk a little bit more about the stuff that we heard about regarding prescription assistance. And we'll do a little digging on that and make sure that we have good links and that those additional resources get in the portal. We had, Kim, I'll just let you talk about that real quick if you want.
I forgot to. The Epilepsy Foundation has just joined with our Epilepsy Alliance of Utah. We're really excited about that. So it's a national program, and they're offering a children's art therapy summer camp, free for the first 10 participants, ages 6 to 10, 12, living with epilepsy. So if you have any patients or you want to take one and put it in your office or whatever, I have a few flyers here. It'll start August 3rd, and so they need to register before then, but it's free for those. We're excited to have the Epilepsy Foundation here in Utah again. So
it looks like it's for a week in the morning.
Oh yeah, sorry. So, yeah, 9:30 to 12:30. That's here in Salt Lake. Yeah.
Cool. We'll send that information out as well. Thanks, you guys. We're happy you came. Grab some more food on your way out.
Mandy? Is Doty here then? Or
South. Not here. That's Intermountain site at the Children's Hospital. Yeah. One of those buildings.
What's out?
That's 51st.
Oh, okay.
That's good.